If you can't see it, you can't treat it. It's as simple as that. A case in point, we took a scan yesterday of somebody who we discovered that their lower central incisors and lateral incisors are fused to each other. Because we've got such a clear view of it, we know it in advance. If we didn't know it, that patient would be undergoing orthodontics and everyone wondering why their teeth weren't moving. My name is John Good. I qualified many moons ago in 1990. So we started down the digital route about 12 years ago. So we had some of the very first versions of intraoral scanners. There wasn't that much you could do with them at that time. Started getting into digital placement of implants 8 to 9 years ago. And for that, we were using external cone beam CTs and external scanners in the laboratories in order to do that. And then we've gradually brought that technology in-house. I mean, obviously we had the previous version of the cone beam CT scanner in the practice. All of the images were of better quality than the previous machines. If we're down on the endo setting, which is a 4x4 size plate, we do get absolutely incredible images through. The number of things that we pick up on the scans is enormous. We're continuing to see more and more things just because we're taking more and more scans of patients. It saves the patient having to go through an unnecessary procedure, and we can make a really, really good diagnostic stab at whether we're going to be able to treat that teeth and be successful at it. The CBCT is connected into 6 of our surgeries. All of the nurses, all of the partners work with it all the time. It's a very, very simple software to use. We use multiple different versions of cone beam CT software that we import our Diacom files into, and certainly the Vatech software is probably the easiest to learn. Since we started dealing directly with Vatech, they're one of our favourite companies to deal with, largely because they're very easy to deal with. We don't have any issues. It's very easy to get hold of them. We don't have to go through lots and lots of different switchboards to get hold of them. So it always feels like a very personalised service. So in terms of technology and lots of other companies that we've dealt with, we find that dealing with Vatech is very easy. So they've made it very simple for us to have this machine in the practice. In terms of installation, very straightforward, particularly in terms of getting their software and the practice management systems all to work together. They don't seem to have any trouble doing that whatsoever, which I can't always say the same of other technologies that we've introduced into the practice. We can usually get it there, but it's normally more of a headache in order to do so. I couldn't come up with one word. I had several words. One of the partners, who is probably the least technical of the partners in the practice, said, "That's a really easy one." I said, "Well, how is it easy? I can't think of just one word." He said, "Friendly." That was his description. And it's because of the way that they've always dealt with us. So he wasn't intimidated by all the technology. Normally I love the technology and the sort of the geekiness behind it. So I see them as being efficient in terms of when I'm trying to get something done. It just seems so easy in dealing with them as a company. But to the other partners who don't have to deal with the technical end, friendly was the word that they chose.